According to his 2001 study, Dr. William McNeil released a statement that said atherosclerosis holds a mortality rate as high as 70% for Americans 75 and older. Atherosclerosis is the root cause of a myriad of diseases and ailments that we experience as we age. Some of these include heart attack, stroke, aneurysm, and even in extreme cases, kidney failure. I come to you today as someone with a passion for biological science. I've done work with institutions such as UAMS and their Level 1 Trauma Center, and most recently I hold an accreditation from the American Heart Association that allows me to interpret arrhythmias. So today, with that in mind, I want to take a brief moment and go over a synopsis of this disease, atherosclerosis, the behaviors that either heighten or lower our risk for developing it, and if we are to develop it, some of the treatments and therapies that have been used to this day. Atherosclerosis at its core is a chronic disease that hardens the lining of our arteries through plaque buildups over time. These plaques are built up through the presence of a toxin or irritant in the bloodstream. Some of these toxins include cigarette smoke, high cholesterol levels, hyperlipidemia, which is the high level of lipids in the blood, or hypertension, which can be high blood pressure. The toxins that I just listed are all known as root causes of this disease. However, there is a symptom that usually accompanies them, which is referred to as hypertriglyceridemia, or high levels of triglycerides in the blood. These come from dietary fats. The irritants, or these toxins that are present, they damage the lining of the arteries, and this allows for the lipids to migrate into the vessel and build these plaques. Thankfully, there have been a number of medications and therapies used. There's medication therapy, there are surgical procedures that are done. However, according to a 2019 statement by the Harvard School of Medicine, medication therapy is the most prominent way to fight atherosclerosis. The most common of these medications given is a group called statins. What statins do is they lower our low-density lipoproteins, or LDL cholesterol, sometimes called our bad cholesterol. Through lowering this, we're able to stabilize the plaques and even in some cases reverse them altogether. What I want to say to you is to fear not. I know initially when I learned of atherosclerosis, it was something that scared me. It seems like so many decisions lead to its development. However, through intentional practice and a conceptual understanding of what the disease is, we can lower those risks. We can change those behaviors. We know the symptom presentation, and if the time ever does come, we know what kind of conversation to have with our healthcare provider. What I want to leave you with is that you are in control. Through obtaining this knowledge, through asking questions, you are able to become your own advocate, and nothing controls you. So, what is it you'd like to do with your one wild and precious life? Thank you.